Well, hello to everybody here. It's Teresa Sanderson. Today we're talking about healthcare is failing nurses and patients are paying the price. All right. So I'm excited to connect with you and just talk a little bit about, what's going on in healthcare, how it is failing nursing, and why the patient is also suffering in the mix. Okay. So this is really important. And I think, the time is definitely now for nurses to come together, right? I have never seen a time in my more than 30-year nursing career that nurses need each other more than ever before. Okay, so this is really, really true. And so I just want to chat about all of this today. Nurses are exhausted, they're overwhelmed, they're pushed to the breaking point. They are still struggling, of course, with short staffing, long hours, high patient loads, all of the things, right? But the truth is, without a strong support system, stress and burnout become unbearable. And if we want to change the trajectory of our profession, it starts with nurses supporting each other rather than tearing each other down. It involves us getting rid of the nurses eat their young mentality and developing a sense of nurses feed their young. The other side of the coin is that, of course, nursing retention depends on nurses lifting each other up, advocating for real change, speaking up, and refusing to accept toxic workplaces as just part of the job, right? That is so, so very important. So the nursing shortage, it's in full-blown crisis. We have, 40% of new graduate nurses leaving the profession entirely within their first 2 years. At least 18% of new graduate nurses leave within their first year. These are not good numbers. Our seasoned nurses, 60% of them report feeling burnt out or symptoms of burnout. And all of this combined puts both patients and nurses at risk. Why? Okay. This is a conversation I've been having with several people lately, is that whenever a nurse asks another nurse a question, whether this is a new graduate nurse or maybe a seasoned nurse who's working in an area that they typically don't work in, maybe they've been floated to work there for the day, right? But they may ask a question or need some support or need some help. At the end of every question that a nurse asks is a patient need. It's a patient need. So if nurses treat each other poorly and can't be supportive because of the culture on the unit or whatever, right? Because it just is what it is, there's always a patient need hanging in the balance. And that's vitally important for us to all really look at. Nurses don't ask questions, typically clinical questions, unless there's a patient need. So we have to begin to have nurses supporting each other, number one. We also are going to be needing some revision of the nursing culture, right? That is vitally important. We need to transform, not revise, but we need to transform nursing culture from one where nurses eat their young to one where nurses feed their young. But bottom line, when nurses are stretched too thin, they're forced to do things like cut corners, use workaround systems for things that don't work, and also work dangerously long hours. Okay. Higher patient mortality rates, about 7%, happen due to increased nurse to patient ratios. Nurses working longer hours after they're already exhausted, maybe additional days in their schedule, are more prone to make medication errors and even having or experiencing workplace injuries from being so tired. Okay. Chronic stress of nurses in these situations, of course, leads to mental and physical health issues among nurses. And I, for one, can definitely speak to that. I can definitely speak to having experienced burnout to the point of true clinical depression and being unable to work for 3 years. I literally had a disability application open on my laptop back in the day. And when I finally connected with the one provider who was able to make an impact with what I've been dealing with. Okay. So I know that this is real. I don't speak from someone who's not been there and done that. Okay. But the solution, we hear so much about self-care. We hear a lot about resilience. We hear, all of these terms. But the truth is that nurses don't need resilience training. The solution is more nurses. retaining nurses, keeping nurses in the game, keeping nurses in their career by having safer staffing, reasonable patient loads, and a culture that allows them to thrive rather than, sucks the air out of the room and that the air that they're breathing right out of the room. Okay. So this is really important. Nurses need each other right now more than ever before, as I said earlier. And a strong support system improves nursing retention. So bottom line, nurses stay where they feel supported and valued. A strong team culture, it's not a nice to, it's a must do. Not a nice to, but a must do. And it's the difference between staying and leaving. So, mentorship matters. Workplace friendships matter. We don't all have to hug each other and love each other, but we need to be able to be friendly professionals to each other. And a culture of respect also prevents burnout and makes nursing more sustainable. One thing I can tell you is that nurses who experience this kind of tension from a nurses eat their young kind of workplace culture, I've been there, done that, remember, seen this in 90% of the places that I've worked in my 30-year nursing career. So living with that toxic nurses eat their young culture means you're going to have more conflicts. You're going to have less than professional communications among nurses. There's probably going to be a lot of eye rolling and heavy sighing when you ask a question. And these things make nurses feel terrible. They feel terrible about themselves. They feel less than. And so, again, rather than building each other up, we're tearing each other down with the very fiber of who we are. So we've got to quit discounting the impact of nursing culture. And I want to challenge every nursing leader, every CNO, every hospital administrator, healthcare administrator in long-term care to actually add, to your exit interview and even your onboarding interviews, have you ever experienced or left a position because of toxic nursing culture? We need to start measuring that. We seriously need to begin measuring what is the impact of toxic nursing culture on your retention. Because until we do that, you're not going to see the numbers. Right now, nursing culture gets wrapped into something called working conditions that can include anything from the temperature in the room. Did you have adequate lighting? Did you have a chair to sit in? I mean, working conditions, that's a lot of it. But also, did you get a break? So there are other things rolled into it as well. But we need to single out nursing culture so that we can really measure the impact on retention. I did a poll back about a year ago and just asked nurses on LinkedIn, got almost 700 responses to the question, have you ever left a position because of toxic nursing culture? 86% of nurses, almost 700, said, yes, I have. Another 7% said, I haven't yet, but I would if I could. This is really, really important, okay? So peer support, supportive work environment in an environment where nurses feed their young and not eat their young. Peer support reduces stress and prevents compassion fatigue. Nurses who advocate also create real change. One thing that I would love to see is nurses unite to advocate for the positive change that they need and that they want for their careers. Because with 4 million plus nurses in the United States, if nurses united, truly united, their voice would be something that no one could ignore. Okay? Something that no one could ignore. So we need to get to that point. So how can nurses support each other instead of tearing each other down? Of course, lift each other up, answer questions, take time. When you have, it's a foreign concept, I know, but when you have maybe a few minutes of extra time on your shift, if there's someone who's struggling, can you offer to lend a hand? That will come back to you on your next shift, and someone will probably ask, hey, you helped me the other day. Is there anything I can do for you? We need to start growing this culture and stepping into it a day at a time, one nurse at a time, so that we can create a better future. We also need things from leadership. We need to prioritize mentorship and guidance so that every nurse has access to support. We also need to take care of ourselves and our peers, because if nurses can't support each other, we're going to be hard pressed to have other people want to step up and advocate for us, right? Do you see what I'm saying? So it's time for nursing to elevate as a profession. We need to step up. We need to be supporting each other. We need to be communicating professionally. And really articulating what it is that we need, articulating well, okay, what we need. So these are just a few things that I wanted to share with you today, a couple of strategies for resolving some of the things that we're going through. But I really want to just state that at the heart of it all is a patient, right? At the heart of all the issues in healthcare, there is a patient. And nurses do incredible, incredible work. Okay. I will never say that nurses do not. I'm a nurse. I love nursing. I love nurses. But we can elevate as a profession and we can step into a new future. We can create a better future for our profession so that our workplace environment can be a place where we can plant ourselves and grow and thrive. And that, my friends, leads to retention. So, thank you for listening. And I want to share with you, our Thriving Nurse Network is going to be launching very, very soon. This is a community designed to support, empower all levels of nurses, from nursing students all the way up to CNOs, nurse entrepreneurs, you name it. We've got a space for you. And so if you're tired of feeling like, you're undervalued, unappreciated, unsupportive, I want to invite you to join our priority notification list today so you can join our community. You'll be the first to know when it goes live. You're going to get some special gifts with that. But also, you're just going to go from those feelings of being unsupported, unappreciated, undervalued to feeling empowered, confident, and supported when you join us. So thank you for tuning in, and I will see you soon. Bye-bye.